Yes. So far, so good. Do you have any question for me? Any question, any suggestion? I'm sure we have about 2 or 3 weeks. Yes, 3 weeks. So next week, we will have our last lecture next week. And the other week, we will have lectures combined with 30-minute quiz. We are going to have 30-minute quiz here combined with other lectures or part of the lectures. And basically, the topics that I will be discussing are law, ethics. We will look at ethics and law, ethical dilemma, ethical principles, and we will also look at nursing and the law. These are the things that we will be doing. But get prepared for a 30-minute quiz next 2 weeks, not next week. Said next 2 weeks. Okay.
Okay, sister.
Yes. So today we are going to talk about the nursing care models. The nursing care models. I'm happy all of us are qualified midwives here, and we do care for our patients. But what models do we use in caring for our patients? And which model best works for us? So today we are going to we will look at the models that are used in the nursing. Please, can you see my screen? I'm sharing my screen.
Yes, sister.
Good.
Yes, sister.
Good. Thank you. Okay, so when you go to the hospital, and everybody knows, yes, that some of you may not know what I'm talking about, but we are talking about the models. How do we care for our patients? What approach, what means do we use in caring for our patients? Do we work in team? Do we assign one person to one midwife to one patient, or all midwives, doctors, and other personnel, we come together as a team and then attend to one patient? Or do we do fragmented care whereby Hannah checks the patient's vital signs, Dorcas gives medication, and then Vera gives advice? How do we do it? And it depends on the hospital setting. It depends on the protocol of the hospital. But among you, the midwives, what works for you? So at the end of today's class, all of you are going to know how, you know the models, the different models that should be used in caring for your patient. And you'll be able to also deduce which model works best for you. You will know which model works best for you at the end of today's class. So different models are used in hospitals and other healthcare settings. Each hospital adapts the model it feels best suited to its goals and resources. Some hospitals decide that when you go to Konfanochi, they do team nursing. At the same Konfanochi, when you go, other parts of the hospital also practice primary health care. Other people also practice case method. So that's what I'm saying, that let's just discuss the different models so that you know which model works for you. So some facilities combine the models. Some uses one model at a time. Some people also uses one model temporarily just to test something, and others also use it permanently. So it depends on the hospital. But what are these models that I'm talking about? 4 models are commonly used in healthcare setting. 4 models are commonly used in the healthcare setting. You should know that no model is perfect for everyone. Somebody may be using the primary model, but it may not work for me. A hospital may be using the team model, but it will not work for your hospital. So each model has advantages and disadvantages. So therefore, these models, you need to weigh and know which model best fits for you. There are 4 models: the case method, functional method, team method, and primary care method. There are 4 models: case method, functional method, team method, and primary care model or method. Now let's look at the case method. The case method is also known as one-to-one method. One-to-one method. Now let me ask you, who works in a facility whereby when you go to work, they share the patients for you? So from morning till you close, you perform everything on that patient, just one patient, till you close. Who knows a facility that employs that method? Anybody?
Sister, when I did my service, male ward, CCTH, that's what they do. They share the patients among their staffs. So if it's 1:3, you do total care for the person. It's only when you need the help that you call another person.
So what were you doing for the patients?
I mean, the client that they entrusted to me, it was HDU area. So the feeding, bathing and everything. But it's only when you need help that you call other colleagues to come. Vitals to you do it together. But all the care, bathing, feeding, everything, so you do it on your own.
So it was a total care.
Yes,
You didn't
sister.
have anybody to check the vital signs. You didn't have a
No,
different person checking, giving medication. You were doing
no, you do it.
everything for this patient.
Yes, sister. Assist
And what do you
it.
think is the advantage for that?
Just like that one, you get to know everything about the client.
Mm-hmm.
So like you learn from what if maybe you don't know, then you ask. But to me, the care that you give, like it's focused one-on-one. So the person trusts you and tells you everything. If maybe you don't know.
Mm-hmm. But what do you think will be the disadvantage?
But
What were
sister,
your disadvantages?
me, what I encountered was during the handing over, we do everything together. But after that day we share. Sometimes you don't when you are busy, like when you need help, the other person to be busy with the other client, that you can't get that aid from that person. So you have to wait for the other person to finish before.
Mm. So what was, aside that, do you think it should be encouraged or it has a disadvantage?
It's like everything has advantage and disadvantage.
Mm-hmm.
So
Mm-hmm.
sometimes if maybe the staff, this is like the staff strength to it is no
Mm-hmm.
good. So it makes you stress out. So
Mm-hmm.
sometimes certain things that you're supposed to do from sister, you just brush off. Then so it should be encouraged in some way and other way to it should be
Mm-hmm.
done equally. Yeah.
Okay, that's good. That's good. Hello, Auntie Dorcas, your hand is up.
Okay, sister, please. So, where I also did my service, some of
Mm-hmm.
the wards, we were doing the males ward and then the surgical ward. They'll share the client to you. In fact, it was not all the time, but sometimes when the clients are more and then the people on duty are also more, they tend to share the client. So from vital second medication, everything. Sometimes they even tell you to draw a plan. That's a plan of the client, if the client or the patient is the new patient being admitted. So you do everything yourself, and then you get to know the patient. When it's time for handing over, you hand over your patient to another nurse who will be in charge of that patient. So that was how we used.
Okay, so thank you for sharing with us your rich experience. All you said was correct, and it is very, very important. Now, the case method is also known as the one-to-one method. My other person said something about this, and I really like that. She said you get to know everything about that patient. The patient tends to trust you, and sometimes they confide in you and discuss every issue with you. And that is exactly one point or one thing. It is very, very important. Now, it is a method of providing care in which one nurse provides total. One nurse provides total. Okay, so one nurse provides total comprehensive nursing care to one or more clients. So the lady said that you will be giving 3 clients or 3 patients, and you will do everything for those 3 patients. So when you go elsewhere, it is 1 nurse to 4 patients. Some different countries, it is 1 nurse to 2 patients, 1 nurse to 1 nurse. It depends on your staff strength. But with the case method, you are giving the patient as a case. This is your case in totality. Everything about the patient. This is your pre-eclampsia patient from morning till afternoon till you leave the hospital. This is your patient. So from vital signs, feeding, hygienic needs, education, everything, medication, everything about the patient, you carry out that responsibility. So this method is usually used by the private duty nurse, the community health nurses, the intensive care nurses, and the student nurses when each works alone. So these are the people who normally practice this method. Now, what are the advantages? Assignments are easy to make because I know that this is my patient. I am the only one who is doing it. It's not as if somebody will come for morning and come and do something different. No, this is my patient. The patient is my responsibility. So I know how to plan my things. I know when to implement. I know when to evaluate. It is my total responsibility. Now, the lines of communications are direct. I communicate patients' findings or patient identified problems to my immediate in charge. Then in charge also communicates to doctor or the physician. So the communication is direct. And then I communicate to my patients. So I serve as a liaison officer between the patient and administration or patients and the physicians. So the lines of communications are direct. Care provided is holistic. I love this. The care provided is holistic. When we talk about giving a holistic care, it means you are giving a total care, taking into consideration the patient's physical, psychological, emotional, and spiritual needs. So the care provided is holistic. I don't only look at the physical well-being of the patient. I look at the physical well-being, the psychological well-being, the spiritual well-being, and the emotional well-being of the patient. Again, the nurse has a great deal of autonomy. Because the patient has been entrusted to me, I take decisions. I plan for the patient's health. So in some way, it makes me autonomous. It gives me some level of power as a nurse. Satisfaction is high for both the client and the nurse because I know nobody will come to assist me Because I know it's my responsibility, my duty, I execute my plan diligently and effectively without waiting on anybody or relying on anyone. So these are the advantages. Everything has advantages and disadvantages. So now let's quickly look at some disadvantages. If you agree with me, you would say that it is not the most efficient way of completing some task. You remember the lady said that sometimes you are alone. So Grace, Jansa, Millicent, Esirifi Yebua. I'm going to mute you. Please check your microphones. Okay, good. So the lady said that sometimes because you're alone, some things you may not complete it for the patients because you are to do everything. And sometimes because you are doing everything, you tend to ignore some part, or some part may not be fully done. So it is not the most efficient way of completing some tasks. Because if you had somebody to support, some things that you may feel reluctant or you may feel tired to do, the person can just pick it up or set in for you. So it is not the most efficient way of completing some tasks. Again, it requires more staff members. And these staff must be registered nurses who have wide range of knowledge and skills. If you don't have more nurses, you cannot practice this. Because what is happening in Ghana now? Go to the ward, 2 nurses, they are taking care of 20 patients. So if you want to practice the case method, and you give these 2 patients to 4 patients to 1 nurse, what happens to the 12 patients? They wouldn't have any nurse. So it's one of the disadvantages that it needs more staff. And it does not just need more staff, it needs more competent, skilled midwives. Because you are going to give everything. You give injection, you give, you set IV line, you feed the patient, you take care of patient hygienic needs. So please, my people, if you don't know how to do this, how can you complete all these tasks? So this an disadvantage. Another disadvantage, it usually does not provide around the clock care. You are not able to finish everything on the patient before you close. Some tasks may be left unattempted or unattended to. Then it requires more coordination among many case nurses and the various health departments. So it all goes back to the point where it requires that your skills, it requires that your midwives should be skillful. If they are not skillful and knowledgeable, you cannot practice this method. You cannot practice this method. It may be too costly for most hospitals. It may be expensive because they may need to employ more people. And you understand how costly that may be. So it is more costly or expensive for some hospitals. It's very expensive. Okay, so these are the advantages and disadvantages. Now let's look at the functional method. The functional method. Now the functional method is the provision. Yes. Auntie Fosti, your hand is up, please.
Yes, sister. I wanted to find out if when we are talking about the nursing care model, is it applying to only patient, in caring for patient, or like just any activity within the hospital?
Please, we are
Why I'm
talking
asking
about
is that,
it is nursing care models, not theories. Okay, please finish making your point.
And because I'm thinking like where some people they'll assign them to BP taking alone, like, so I wanted to know if it is only talking about caring for patient or
You said some people will be assigned to what?
BP taking, like checking of vitals only.
That is exactly, that is the next thing, the next model we are about to talk. We are about to discuss.
Okay. Okay.
That's the functional
Okay.
method.
Thank you.
That's the functional
Okay.
method,
Thank
my
you,
dear.
sister.
Here,
Okay.
let
Thank
me
you.
just say to everybody, with the models, the care models, we are talking about how we can deliver our or render our services to our patients at the ward. So, sister, and firstly, the functional one is what you just brought in. Functional method is the provision of nursing care in which one nurse is assigned to do specific tasks for a large number of clients, rather than being assigned to complete all tasks for a smaller one. So when you go to work, you do task sharing.
Yes.
So,
Yes.
Hannah,
Thank you.
you check BP or you check the vital signs. First, will give all medication. Doris will do the wound dressing. Mary will be changing the colostomy bag. You see, it is a functional method. We have divided the to different segments or functions. So if you are practicing,
I get it, sister.
You get it. I hope the whole class, everybody also gets what we are discussing.
Yes.
So when you go to the labor ward, somebody monitors the progress of labor using the pathograph. Somebody checks the blood pressure. Somebody checks the urine. Somebody also monitor the FH. I mean, you have given functions to different people, and that one is the functional method. With the functional method, everybody has a role to play. Everybody has a role to play. So it's the provision of nursing care in which one nurse is assigned to do specific tasks for a large number of clients rather than being assigned to a complete. So rather than me giving you one patient for you to do virtually everything, just as the case method, with a functional one, Bernice performs this, Hannah performs this, Joyce does this, Lydia do this, Ruth does this, Kate is doing this. With this method, one registered nurse might be assigned to give medication to all clients. Another registered nurse might be assigned to do all treatment, and a health assistant may be teamed up to provide. I'm saying that sometimes you may get a ward assistant assisting you in the discharge of that duty. So sometimes with the functional method, even though you are doing it alone, when you have more people, the student nurses, they are sometimes assigned to you. Rotational nurses, they are assigned to, I don't know, these are things that are happening at the ward, right? Don't you practice these things? Don't you see these things at the ward? Is that not what is practiced at the ward?
Yes, sister.
And sometimes you even put some people on errands that they are errand nurses.
Yeah.
And it is so funny when the student nurses come, or student midwives, when they come to the ward and you have more staff, sometimes you put people at the lab. Some people, you put them at the dispensary. Don't you do all these things?
We do.
Yes.
We do.
Yes. And that is what I'm talking about. That's why before I started, like, with the introduction to this, I said that these are models that you practice or you use, but you may not know that these are the care models until I start to teach. Now let's look at the advantages of functional method. Assignments are fairly easy to make. True or false? True. Because if I know that I'm only checking vital signs, that is the whole thing. That's what I'm doing for the whole shift. So it's fairly easy to make. Lines of responsibilities are clear. If I go and the patient has not taken medication, it is Hannah who has to give medication. It is Bernice who is dressing the wound. So the lines of responsibilities are very clear because I know that I am dressing wound. Kate is giving medication. Bernice is feeding the patient. Ruth is bathing the patient. Gladys is performing this. So it is clear. Everybody knows his or her responsibility, and it is very clear. Now, due to the narrowed focus of care, workers can gain expertise and skill and can do higher quality work. Okay, so with this, I'm saying that because I'm checking only vital signs. Hello, let me ask you. Because you are the one performing the vaginal examination for the patient throughout your shift. Hello, at the end of performing for 10 patients within the day, are you going to learn something? Will you learn something from what you do? And are you going to gain experience because of the repeated means of carrying out that procedure still?
Yes, sister.
So because I have been tasked to give medication today, by the time I close, I'll get to know all the patient conditions and the medications, different medications or different drugs that are given. Because I have been assigned to conduct deliveries, I'll get to know the different mode or the different presentation styles for the children or for these fetus. I'll know that somebody came footling, somebody came. I'll get to know the normal delivery, and I'll get to know the normal presentation and the bridge presentation. Because I have been tasked to do that throughout the day. I get to see different vagina, different sizes of the cervix. I get to see all these things. And I get to know that even some babies, when they are born, they have meconium stain. They have this. Some people have clear. Some people, and you get to know that, oh, this is a cow baby. This baby came out as a cow baby. I mean, all these things you get to know, and it makes you rich in knowledge. Now, more semi-skilled and unskillful workers can be used than with the case method. Now, with the case method, you need an expert. You need somebody who is knowledgeable. But with the functional one, you can even decide to use student nurses because they are not well skilled, but they know how to check vital signs, and they are not going to give injection. So with the functional one, I can give the vital signs to the students, whilst I give the injections or medications to a professional nurse or a professional midwife. And is that not what you do at the hospital?
Yes, sister, we do that.
Sister. And the funny thing is that the student nurses, when they come to the ward and they are checking vital signs, somebody will be holding a pen and paper. Somebody will be holding the thermometer. And somebody will also be holding the BP. It's fake. So somebody will check the patient's blood pressure and then will tell the colleague, please record the BP. And somebody will check the. I will not be surprised if I go to a hospital and I see somebody holding cotton alone, cleaning the axilla for somebody to insert the thermometer. I will not be surprised. I will not be surprised. So, and this one advantage is that even if you don't have qualified, you can still practice. This method is used when staff shortage exists. When staff shortage exists. Faustina Suriaba Nana Kwame, there be a unhu towel. Yes, yeah, dear cry now, mamma, your towel. Nana Faka won't say, baby. I know no dear rejoice. A banner everywhere in a tower, and him rejoice as soon. I can see your woman here do. You make life simple. Some of you, the above, you somebody who is chopping lab, and still have a Bluetooth or the earpiece. Look for your son's towel for him and concentrate, because the class is getting more interesting. Please, these things that I'm teaching you so that when you go, you can apply them to your daily practice. So this week, I'm expecting you to use these models, okay?
Okay, sister.
Good. Now, let's look at the disadvantages. Everything has advantage and disadvantage in this world. Nothing is fair. Now, the holistic view of the client is lost because you are not going to stay with the patient throughout the shift to provide total care. You are not able to give holistic care because somebody comes to tackle the physical aspect. A different person comes to tackle the psychological, and a different person comes to tackle the emotional and spiritual. So you cannot give holistic care compared to the case method. Now, the care provided may become rigid, mechanic, impersonal, and boring. The client's psychological and social needs are often overlooked because my task is to check your vital signs. So if you are emotionally down, I don't have any issue to do with your emotional stability. I don't have anything to do with it if you are emotionally down. So, or some other aspect of you may be neglected. Now, satisfaction is generally low for both the client and the nurse because the nurse, the patient or client will see, within the day, he will see about 8 nurses. I hope you understand why I'm saying he will see 8 nurses. Why will he see 8 or different nurses? Why?
Sister.
Different person with different procedure.
Why would that happen? Why?
Because we've shared the duties. Different person
Because
will
of the functional
vitals, or
yes.
different person will be attending to it.
Yes. So it's true. You'll be seeing different people, and sometimes you don't even know whom to trust. And if you have problems, sometimes you don't even know whom to discuss with because you have different people. Okay, now let's talk about the team method. With the team method, team nursing, with the team method or team nursing, with the team method or the team nursing, group of nurses and ancillary staff led by registered nurse, team leaders provide nursing care to group of clients. So the difference between the case method and the team method is that the case method, you get one person handling the case. But with the team method, you get about 5 people forming one team. Who works? Do we have some people here who works using cubicle based? Like they assign 5 nurses to one cubicle or 2 nurses for one cubicle. So you take this cubicle. So 4 people, you are the team. So this is team A. You are for cubicle 1. Team B, you are for cubicle 2. Who practice that? Do you have anybody here who practice that?
I don't
Hello?
think it's in Ghana. We don't practice that in Ghana.
Oh, it is in Ghana. Confanoche
No,
practices
it
that.
is we do some. We do some.
CPPH crowd, they practice that.
Oh, even Confanoche is there.
Confanoche.
We do same.
They do that.
I know
A3. When you go to
Confanoche, it is practiced.
Confanoche
So like
A3.
5 people, they put you in a team. So they will have a team leader. So among the team, the team members decide. It's more of the functional one, but we know that you are caring for the person in team. So not just one person, but a team goes to the patient. So the team, somebody tackles physical, somebody tackles, it's a teamwork. It is done. So with a team method or team nursing, groups are nurses and auxiliary staff led by registered nurses, team leaders, provide nursing care to group of clients. With this method, each team leader must be highly effective, democratic leader with special skills in teaching and communication. So with this one, the leader, you must be a democratic leader. You must share and receive ideas. You should not be an autocratic because you are working with people in a group or in a team. So you should be ready to share your experiences with each other. So the advantages of the team method, a high quality of care may be given with fewer registered nurses than with other methods of delivering care. Now, whenever possible, the client is included in planning.
Why?
Hey, Laurentia, I told you, Mammy, Obronia, Miss Romy shoe. Bronia's shoe in a space. Laurentia Menza. Yeah, to shoe in a space, and it be Mammy, why, Bronia. You have quickly unmuted yourself. Unmute. Mute yourself. Mute yourself. Yeah, one day. Okay, so whenever possible, the client is included in planning. That's one advantage of the team method. The client is included in planning. The client is included in planning. Phyllis Banchebay. Phyllis Banchebay. Ade Phyllis Banchebay. Please concentrate. I know that you are always tired in the weekend. That's why I try to make my classes short, but make sure I deliver what you are supposed to learn, okay? So
yes,
please,
sister.
I will soon finish for you to go and pound your fufu. We have just 4 slides to go. The fellas manchen so the month is 30 minutes, even less than 30 minutes, we will finish, okay? Okay, so the care provided is comprehensive and holistic because you are working in team. You are working in team. The satisfaction is generally high for both clients and staff. Hello, Isa.
Sister.
Aika. Yes, please.
Please, some people have their videos on. If I let them to off it.
No, let's see their panties and their brizes. We want to enjoy.
I'm even sleeping.
My gentleman, today is free show.
Everything that comes out.
Hey, sister.
Please, let my gentleman enjoy today. So we are waiting. You can put on your videos, your screens. You can share them. My gentleman, are you here?
Yes, sister. We are there. We are watching. We are watching them.
We are here. We are here. Hey.
We are watching them.
Official.
Okay, so with the but please, I hope you understand the presentation and what we are discussing today, right?
Yes, sister.
Let's
Okay, so the care provided is comprehensive and holistic because you have people, different people in this, and then satisfaction is generally high for both the clients and staff. Morale or team spirit is generally higher because I'm not working alone. So sometimes when I feel tired, I feel relaxed, somebody will tell me, sister, let's do it. Let's do it. We will finish soon. Hey, it's 1 o'clock. We are just left in 1 hour to close. Check vital signs, document everything you need to document. So a teamwork, the team morale and the team spirit is there. Then different types of combinations of care methods may be used by the team method. So during the team method, you will see all the other methods. Somebody will be practicing case method. Somebody will practicing functional method. And you see all the methods will be applied because you are working in team. Now, disadvantages. Some efficiency is lost as compared to the functional method. Not all registered nurses are skilled at management, communication, teaching, and democratic leadership as expected of a team leader. The team leaders may not know their individual clients as well as nurses who use other model of care. This method of care is often done poorly. Now, let me ask you, which of the methods do you think that the patient, there's a good or it leads to establishment of good rapport between the patient and the client? And which of these methods do you also think that the patient gets to know the patient very well?
The case method.
Case method, sister.
Yes, it's a case method. Yes, it's the case method. Now, let's look at the last one, the primary care method. The primary care method is a method of providing nursing care in which one nurse takes responsibility for making the initial nursing assessment, making all nursing diagnosis, planning all nursing care, and ensuring the implementation of the plan for a group of clients 7 days a week or 24 hours a day. The primary nurse is also responsible for evaluating the outcome of client care. So the primary care method, maybe Hannah, I am the nurse. So what I come to do is the drawing of care plan. That's the only thing I do. Draw care plan. Then after drawing that care plan, or after the primary care stage, it's either a team care model continues, a case method continues, or a functional method continues. So this one, you provide the nursing care by taking responsibility for making that initial nursing assessment. So it's just like you draw the care plan. And when you draw the care plan, you are going to use the care plan for a whole week. And it is 24 hours. So this one applies to when you travel outside, we have some patients who are taking care at home. So that one, they call it living. A nurse goes to stay with the patient in his or her home 24/7. So 24 hours within 7 days. Then she draws the care plan for the patient. So some of the problems, she aims at achieving it within 3 days. Some should be achieved within 2 days or within a week. So she stays with the patient for a week and then gives the care. Not that she goes for morning, somebody comes for afternoon. No, continuously within 1 week, the person renders her care or his or her care to the patient. That is the primary care. Then, unlike the case method, the primary nurse does not always provide the total care, but does take responsibility for completing complex nursing tasks and for delegating other tasks to appropriate person. So even this one, he goes there for 24/7. If there are other tasks which is not within her domain or which is not within her abilities, she delineates or she delegates that part or role to a different person to do that. So this one, is just like the case method, but the time frame or the duration for the primary care model is longer than the case method. And when the primary nurse is not available to do indirect client care, such as on off shift and on days off, a number of other nurses. So like after the week or after giving that primary care, if she's not there, different people step in to take up for the patient. So the advantages of that one, the primary nurse has more autonomy than the other methods. The primary nurse spends more time in direct client care activities than in coordinating and supervising care done by others. Nursing care provided is holistic. Satisfaction is generally high for both clients and staff. It is a cost-effective method because there is less nurse turnover. The disadvantage is it requires a greater proportion of registered nurses. Not all registered nurses have knowledge and skills required for this role. Some auxiliary personnel have no sufficient knowledge and may feel less satisfaction with this model. Because this model demands that you get a skillful and expert in doing that. So in conclusion, I'm saying that no matter what nursing care method is used in your facility, each nurse is expected to use the nursing process to assess, diagnose, plan, implement, and evaluate the nursing care you provide to your patients. That is one thing you should know. That's one thing you must know and you should know. So these are the nursing care models which are used, and it is advisable as nurses and midwives you employ one of these methods to use in the discharge of your duties. Hello, Auntie Mercy. Your hand is up.
Yeah, sister. So which method does the night soup falls under?
The night soup.
Yes.
The night soup, they are just supervisors.
Okay.
They don't have any rule. For me, what do they do? Don't know the night soup, what do they do? But some night soup performs alongside. Some night soup, they are just like hospital matrons, or they present themselves as CEOs. Sometimes when they come and you are sleeping, they want to wake you up. Hey, some night soups are bossy, papa, as if they own the hospital. Sorry to those who do that.
True.
Abigail, Auntie Abigail, please. Let's hear you.
Sister, please, my question is, how come community health nurse falls under case method?
Sometimes they have cases within the community. The person may be at home, but it is a case, and the person may go and render that service to the person at home.
Okay, so it's like those who go for home visits and they have special clients.
Yes, not those who are working at the hospital.
Oh, okay. Thank you.
Hey, until and Obin, please keep quiet. Hello, Auntie Esther. Hello, Auntie Esther. Esther Yakubu, your hand is up. Hello, Auntie Fasti, please talk.
Yes, sister. I just wanted to add to what you said to my sister that asked a question concerning the community health nurses being under case method.
Yes.
Mostly the job description of the community health nurse is mostly at home. Like they're supposed to be doing home visiting a lot. So like if you look at their job description, it will be case method because they are supposed to provide services to their clients at home mostly. So if you are looking at it in that direction, it should be the case. They should fall under the case method. I just wanted to add.
Yes,
Hello,
before
please,
you. That is why sometimes when you do your care studies, patient family-centered care study, you normally hand over to community nurses. Don't you hand over to community nurses?
Yes,
we
sister,
do,
because
we do.
They are staying with them in the community.
yes, sister.
Mm. Okay. Is that Auntie Esther? Your hand is still up.
Yes, please.
Okay.
Sister, please, I want to know, like those midwives who are working in a health center and then chef's compounds, where can we put them? Like the nursing models, which one will we put them on? Will it be under
My
the
dear,
primary care?
Auntie Esther, please, I will not let you finish.
Okay.
The primary care method, the nursing care models, it is not hospital binded. It is your activities, how you carry out your activities or how you discharge your duties towards your client.
Okay.
So somebody may be at a CHIP compound, but the person is practicing functional care. Somebody may be at the CHIP compound and the person is practicing case method.
Okay.
You get it? And somebody may, so it is not as if all healthcare health centers should practice case method. Teaching hospitals should practice functional. No. Auntie Esther, please, are you okay?
Yes, please.
Yes. So at a point in time, the method you are applying is what matters, not the center.
Okay.
And at every point in time, you put one of these methods in practice. It may be that Monday, when you go to work, you practice functional because you have more people, you have more student nurses and rotational nurses at post.
To work with. Okay.
Yes. Tuesday, you practice case method because you are only few.
Okay.
And your patient's conditions are critical, so you needed to give them much attention. Are you getting it?
Yes, please. All right.
Hello, Auntie Erica.
Thank you so much.
You're welcome, my dear. Auntie Erica, please talk.
Can you please take the primary method?
Can you do what?
Primary method. Can you explain it?
Your voice is too faint. I can't hear you. She said, can you?
Sister, she said she would like you to take the primary method again for her.
Oh, okay. Thank you. So, the primary method, I'm saying that it's almost like the case method, but the difference is that the primary one, you identify your own problems using your care plan. But the case method, it could be that it has been already identified or you have to identify it. Are you getting it? This I didn't hear you. Okay, I'm not hearing from Okay, do we have any contribution, any suggestion? Any contribution, any suggestion? Okay. If there is nothing, then we will bring the lectures to an end. But I hope you have achieved our learning objective, or we all had explanations, right?
Yes, sister.
Okay.
The midterm, can we check our results? The midterm that
You said, can you do what?
can we check our results?
I will compile and send it to you once I get it from IT. This
Thank
week,
you.
some people will be doing it. Those who did not have access to internet, they'll be doing it. And after that, as soon as I get the results from IT, I'll push it. Just as the raw state they submit to me, I'll push it to you. And I don't know, I'll be very happy if you can hold on so that we have our quiz done next 2 weeks.
Okay,
And
okay,
probably
sister.
we'll look at
No
your
problem.
30% score. I think that would be better.
Okay, sister. Thank you.
Okay. Enjoy your week. Lots of
Hello,
love to
sister,
you.
please. I heard you say something about the objective. I didn't get it clear.
Patience, what did you say?
Sister, I said I heard something about objectives, but I didn't get what you said.
No.
Well,
I said next 2 weeks we will have maybe some 20 objective questions for our midterm. And I was asking whether today, because I said today we are going to discuss the nursing care model. So I was asking if we have met our objective, because our objective today was to discuss the nursing care models.
okay, thank you, coach.
Okay.
Hello, sister.
Yes, so is this Auntie Dorcas?
No, this is Putin. Sister, this is Putin now.
Sister, please, hold on, because you are making noise. I can't hear you.
Comfort by Abba. Mute yourself.
Okay. Please ask your question. I've muted everyone.
Okay, sister, please. About last week, how do you call it? The lectures. We didn't get slides for that. The community.
Yes. Nobody also reminded me. I was very tired this week. Thank you very much. Thank you. Okay.
Thank you too, sister.
Thank you. I'm going to send you a recorded lectures. I'll send you something. Don't worry. Okay.
Okay, thank you very much.
Thank you very much for reminding me. Okay. So, hello, Auntie Grace.
I wanted to find out those of us that were having problem with the network, the time that we used.
Yes, I said this week because I am still talking with IT. Okay.
Okay, thank you.
Okay. Thank you, and bye for now.
Thank you, sister.
Bye, and
Okay.
God bless
Lots of
you.
love to you all. Take care of yourselves.
We love you, sister.
We love each other. Bye-bye.
Bye.
Bye.